Good morning. So, in our last part of this anticoagulant, so we are going to discuss about the warfarin. Now, warfarin it is a oral anticoagulant. Clear? It is oral anticoagulant, but it is acting as a in vivo. They do not have any effect into the in vitro condition. It is only used into the in vivo. Because this is why they are not acting into the in vitro, because they are acting indirectly by interfering the synthesis of the vitamin K dependent floating factor in liver. Already we have discussed about the vitamin K in our first part of this class. So vitamin K synthesis, and there we have find that different factors of vitamin K is responsible for you can say that like activation of the factor 7, 9, 10, etc. So this warfarin they are going to affect on that particular area, clear, on that particular area. So they are interfering the vitamin K synthesis, thereby they are interfering with the different factors which is responsible for the blood clotting synthesis. But what is the important? Warfarin having the very narrow therapeutic index. Clear? Warfarin having the very narrow therapeutic index. Now here again descarboxyprothrombin or factor 7, 9, 10 in presence of guanyl carboxylase, it will convert into the uh, prothrombin or factor 7, 9, 10 activated. Clear? These are the things is the activated. And why it is happening? Because vitamin K hydroquinone it is converting in the you can say that using this into vitamin K epoxide. Clear? Epoxide. This conversion is required for vitamin K hydroquinone to epoxide conversion is required for the activation of these factors, floating factors. Again, vitamin K epoxide in presence of vitamin K epoxide reductase, and they are NADP8, NADH to NAD conversion is there. It will convert into the vitamin K hydroquinone. So that is already we had discussed. Now, oral anticoagulant or the warfarin, they will going to inhibit here. So there is that means they are inhibiting the vitamin K epoxide reductase. Now, if they are inhibiting the vitamin K epoxide reductase, so there will be no conversion from the vitamin K epoxide to vitamin K hydroquinone. So they are inhibiting the vitamin K epoxide to vitamin K hydroquinone. You can say that uh, synthesis. And if this synthesis is inhibited, this synthesis, that means vitamin K hydroquinone to epoxide conversion also is not there. If it is not there, then there will be no activation of the 7, 9 and 10 clotting factors. So by this mechanism these drugs are active. Now, warfarin, it is used into the prevention and the treatment of the different disease condition, cardiac disease, clot-related disease. It may be used for the stroke, or you can say that like arterial fibrillation, it may be there, or you can say that in case of the uh, deficiency of the different protein C, S, etc. This is also you can say that used, or they may be used as a prevention purpose also for the venous thromboembolism. So you can say the different types of the surgery. Now, principal adverse effect is hemorrhage condition. It may cause the hemorrhage, and you can say that it is you can say that they are increasing the bleeding risk. Now, skin lesion, necrosis are the rare complication with the warfarin therapy, but purple toe syndrome again it is a rare, painful, and blue tinglet discoloration of the toe, which is known as a purple toe. It is caused by the colloid emboly of the plant. Now, warfarin is a teratogenic in nature, so it should not be used during the pregnancy. And if the anticoagulant, you can say that because if certain cases in the pregnant women, if they require any anticoagulant, so it is very useful if you should give the heparin, not the warfarin. And for the warfarin, they having the very you can say the contraindication with the large number of the drugs. So These are the some of the reference you can go through for the details.